Good morning, everyone. My name is Christopher Wong, and I'm a PhD in STEM Programming Coordinator for the 12th Annual UC Davis Pre-Medical and Pre-Health Professions National Conference. I would like to thank AAMC for sponsoring and supporting this event. This morning, I have the honor of introducing Dr. Samuel Nussbaum. He earned his medical degree from Mount Sinai School of Medicine and trained in internal medicine at Stanford University Medical Center and Massachusetts General Hospital. He also trained in endocrinology and metabolism at Harvard Medical School and Massachusetts General Hospital. Today, he is the Chief Medical Officer of WellPoint, the largest healthcare company in the Blue Cross and Blue Shield Association, serving nearly 69 million people. Dr. Nussbaum is the key spokesperson and policy advocate of WellPoint and is responsible for the company's public health policy programs. He oversees corporate medical and pharmacy policy and clinical quality programs to ensure the provision of proven effective healthcare. Everyone, please give a warm welcome to Dr. Samuel Nussbaum.
Good morning, and thank you, Christopher, for that kind introduction. It is indeed a pleasure to be here with you this morning because healthcare is undergoing a fundamental transformation, and you're going to be part of that, and hopefully you will be leading that. I've had the privilege of looking at healthcare through three lenses. The first 20 years at Harvard and Mass General as an academic physician, advancing knowledge, doing clinical research, and teaching. And let me just say there's no higher calling than teaching the next generation. The second phase of my career was at a very big health system, medical school and hospital system in St. Louis, so Washington University and BJC. And the third is now in the realm of health benefits and health insurance. What is most stunning is that through the lens that I have now at WellPoint, we are the largest provider of services for state Medicaid programs. In addition, we in California are the largest provider of health benefit services on the exchanges, so we're very involved in the new world of health reform. And what I want to share with you over the next few minutes is very much the real-world experience of healthcare. You've heard from my colleagues extraordinary stories of personal devotion, of the commitment that they've made, of education. But the real world of healthcare is broken today. So in many ways, like the opening of A Tale of Two Cities, we live in the best of times and the worst of times. The best of times because we have breathtaking new knowledge. We understand the human genome. As Harvey said, medicine is personalized. But the worst of times because we have quality issues, access issues, healthcare services are not equitably delivered, and we have costs that are stealing from all the other social determinants of health. We have $700 billion of waste in our healthcare system. When you go to a health professional, you can flip a coin because it's as likely as not that you will get care that's state-of-the-art and scientifically based. And just think about this from a Medicare perspective. If you're hospitalized, 1 out of 5 Medicare beneficiaries will be rehospitalized within 30 days because we've missed the mark. We've missed the opportunity to coordinate care. I don't know if any of you have seen this company. It's called Despair.com. They sell demotivational posters. So not soar like the Eagles, but in this case, mistakes, it could be the purpose of your life, is only to serve as a warning to others. So let's look at that in healthcare. You've heard of Six Sigma. Six Sigma is where American industry, manufacturing, and all of us should operate, near free of defects that are hundreds of thousands. But in healthcare, it doesn't happen that way. If we look at detection and treatment of depression, we can do better. If we look at the use of antibiotics, we can do better. If we look at hospital-acquired infections or adverse drug events, we can do better. And that's the challenge that each and every one of us has, and the challenge I share with you, which is as you enter healthcare, make it better. Patients want a very different experience. They want you as physicians, nurses, and other health professionals to be accessible by email. They want you to coordinate care. They want you to coach them about staying healthy. They want social media tools and personalized plans. This is the world that you're going to be entering. And you're going to be entering a world where there is not enough supply of health professionals. Look at that requirement for more physician training, but it goes beyond physicians. There will be almost a doubling of nurse practitioner jobs and physician assistant jobs. So every realm of healthcare will increase in its capacity because healthcare in the future is going to be team-based. And we're seeing a blur. While physicians are increasingly being acquired by hospitals, it is likely, 80 to 90% likely, that when you graduate, you will be employed in a very large organization, either a health system or corporate organization, because health plans are acquiring delivery systems of care, hospitals are becoming insurers. This is the world that you're entering. And the payment models are going to change very profoundly, led by private sector companies, led by Centers for Medicare and Medicaid Innovation and CMS. We are moving to value-based payment, away from a fee-for-service model, which encouraged overuse of services. And along that way, along that journey, we need to think very differently of how we deliver care. We need to use big data in meaningful ways. We need to build this care continuum. And today, across WellPoint, we pay dramatically differently to hospitals and doctors, and increasingly, about 40% of what we spend, of the billions of dollars we spend, represent arrangements where we're paying for value, paying for quality, paying for clinical results, not just paying for units of service. Let me give you a very specific example of what we've done in California, working in provider partnerships with hospitals. This represents something that no one wants when they leave a hospital or go to a hospital, and that's an infection. And you can see we've been able to reduce hospital-acquired infections by working together. 182 California hospitals linked together. We also have decreased elective preterm deliveries by 74%, giving mothers and babies a healthy start on their life together. And we have worked with Organized Medicine, the American Academy of Family Physicians, and others to build what are called patient-centered medical homes, where care is coordinated, where there are teams based in care. And you can see in Colorado, New York, New Hampshire, across the country, care is of a higher quality. Costs are coming down. Because we know when we look at costs, they're highly concentrated. There are a handful of people who have most of medical need. They have complex illness, they have diabetes and heart failure. So if we look at Medicare spending, the top 15% of people spend 75% of dollars, and we can do better in coordinating that care and their care. So right here in California, we have built a model called Care More, where the quarterback is the physician. So she or he is working in an incredible team, a team of care management nurses and others, undergirded by information, using social workers and lawyers in a facility where this top few percent of individuals who spend so much and whose care has been not well organized get a very different outcome of care. On a quality front, their diabetes care is better. There are less hospitalizations for heart failure. There are less amputations. And if you look at what this means, it's time at home, not in hospital. We have programs for children with asthma where it's time at home, not in emergency rooms. And we have more to do. So if we look at health inequalities, this quote by Dr. Martin Luther King is so compelling. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. We are working with many across the country to understand why African American women are not getting the same care for breast cancer as others. This is an area that you are challenged to attack and must attack. And the safety of medicine, we need to, again, continue to advance. As this cartoon says, warning contains FDA-approved drugs. So we're working with data, with the FDA, with the CDC to make sure that our vaccines, are safe, that our drugs are safe. So after a drug is approved by the FDA, we're using our data, our clinical claims, to be sure there are no severe consequences of those drugs. And we've been able to identify going forward that drugs and vaccines are safe and effective. Because you're entering a new era. You're entering an era where we need to better manage chronic disease. So if we look at childhood obesity, that's an epidemic that will lead to coming attractions of diabetes. But at the same time, we have global health concerns. And you're all very familiar with Ebola and the extraordinary and devastating toll it's taking in Africa. That's the dual challenge you have. Innovation has been the hallmark of the American healthcare system. So when we look at the development of statins that have reduced cardiac death rates, when we look at what antiviral drugs have done with HIV/AIDS, converted a death sentence to a chronic illness, and when we look at the screening and drugs to improve cancer survival, this is the breathtaking science that you're entering. Yet, how do we use science wisely and widely? How do we continue to invest in innovation? And there's a recent example you may have seen in the media. It's a drug that is very effective. I mean, cures maybe 95 or more % of people with hepatitis C. So breathtaking treatment, breakthrough therapy. Yet, can we afford this as a nation? Here's an example in California alone. If we only treated the prison population and Medicaid in California, you see $51 billion. Look what that will do to very critical social determinants of health, be they education, transportation, or any other key aspect of we have to invest in society. And I want to close by talking about information. Atul talked about, MCATs and how you need to be prepared. But let me assure you, as well prepared as you are today, knowledge is advancing at such a phenomenal rate that you will not be prepared 3 years from now and 5 years from now unless you can keep up with that knowledge, and none of us can. How can we keep up with 1 million new medical articles a year? Billions of searches are being done. So this is an example, an area where we've worked with IBM and their supercomputer Watson, which was very successful on Jeopardy, but to see if we can teach Watson how to guide us to better care. So we have taken Watson and actually sent Watson to medical school. We have taught Watson all of healthcare. Watson has read textbooks, Watson reads medical journals, and today Watson is guiding our nurses, doctors at Memorial Sloan Kettering in New York to better ways of caring for individuals with cancer, because Watson knows the molecular biology of cancer that sometimes we as physicians and health professionals may not always be mindful of. The next healthcare revolution is going to be in consumer technologies. How many of you are wearing Fitbits or Nike products? A number of you? Well, think about your patients in the future. They're going to have wearables, devices. They're going to have contact lenses which monitor glucose. Thank you, Google. We're going to have telehealth, where you're going to be available 24/7, not necessarily you, but healthcare will be available 24/7 through, again, a very different approach through your smartphones. Now, you might say, Sam, that's a vision of the future, but let me assure you, it's happening today. We have a company that we've invested in called America Well, and a program called Live Health Online, if any of you want to go to it, where literally today, right now, you can select a physician of your choice. You can see everything about that physician and get care telephonically. Think of how that's going to transform healthcare. So as we look to the future, and it seems to be a Steve Jobs day of quotes, but think about this. Think about as you advance knowledge. Don't waste your time and your life living someone else's. Don't be trapped by their dogma. Don't let the noise of others' opinions drown out your own inner voice. And most important, have the courage to follow your heart intuition. So thank you for your journey to make a difference in the lives of so many people. I appreciate the time with you.